have Laura, Ariane, and Nick. And on the opposition team, we have Mo, Leah, and Shamika, ladies and gentlemen. We are going to get settled here. And Prime Minister's team, begin your arguments.
Alright, who has heard of Ebola?
Ebola.
Everyone, right?
Oh,
It's everywhere, plastered everywhere, all over news, all over, everyone's going crazy about it. It's an epidemic affecting our world today, sweeping the nation. Specifically, West Africa, they got a lot of stuff going on over there, taking a lot of criticism for it. Travelers are not cautious upon re-entering the U.S. with this, because obviously we have had cases in the U.S. So we are going to talk about today how easily this disease is spread, how fast Ebola takes effect, and how many people have died, all to support the 21-day quarantine policy.
So, how easily does Ebola spread? Well, articles from the World Health Organization on personal protection, the Center for Disease Control, both their article on human-to-human transmission and just plain old transmission, and then the Journal for Infectious Disease article on assessment of the risk of Ebola transmission all stated that the easiest way to get Ebola is through physical contact. That can be through, just touching someone, broken skin. The Center for Disease Control and USA Today article on the 5 facts or 5 things you should know about Ebola all stated too that objects like syringes and poorly cleaned scalpels can also transfer disease. So that counts as physical contact, because in the WHO's article, they talked about how personal protection is big, but if you're not being careful and you stick yourself with a needle that you've used on a patient, you can get Ebola very quickly, and that's directly into your bloodstream right there. Lastly, Fox News had an article about Ebola, saying that Ebola is spread when people come into contact with the virus through bodily fluids, and then they make contact with their eyes, their mouth, their nose, and that goes right into their mucus, which goes right into their bloodstream. So to go along with the bodily fluids, besides stool and mucus, you can also get it through breast milk, tears, and of course, a nosebleed or just blood. And that's all contact that can make contact with your skin. I just want to reinstate that fluids are not airborne. So the CDC, or Center for Disease Control, stated that only under extreme conditions has this been proven to go airborne, but that was under experiments with animals, and is not yet able to do that for humans. So we're lucky in that matter. But the Huffington Post also stated that there is no evidence that Ebola is spreading through coughing or sneezing. So it's got to be through physical and physical contact. And that's why we need the quarantine for 21 days.
Alright, once affected, there are symptoms to watch for. They're flu-like symptoms, which is why people don't really take it serious when they first are affected with it. It's like nausea, vomiting, fever, diarrhea, fatigue, stomach pain, stuff that you would just kind of be like, oh, I got a cold, not take it too serious. The symptoms take an average of 8 to 10 days to show, or 2 to 21 days to fully affect you, which is why the 21-day quarantine is necessary. And people who recover from Ebola actually develop antibodies from it for at least 10 years. So the quarantine is necessary in order to stop it from spreading. Oh yeah, people must wait 21 days. So, yeah. The U.S. is allowed to deny boarding of passengers for the benefit of America's health, and quarantines have been practiced since the Middle Ages. We're not as crazy about it as we used to be. They used to make people anchor their ships out for 40 days if someone was sick. Imagine trying to do that now. But the CDC now has quarantine station personnel at local borders, airports, and ships to make assessments of ill passengers, for Ebola, which is necessary because it's such a fast-spreading disease.
When considering to enact 21-day quarantine as a policy against Ebola, the death rate is certainly something to consider. Death rate can be explained as the ratio of deaths of a population in a particular area due to a certain cause, in this case Ebola, obviously, over a specified period of time. WHO, or the World Health Organization, currently assessed the death rate of Ebola as 70%. This is a 20% increase from what was previously assessed, that being 50% back in 2012. The number of reported cases of Ebola, according to a CNN report dated from November 1st of this year, reports that there is 13,567 cases of Ebola, cases that includes confirmed cases, deaths, and unconfirmed cases, like just calling up and saying, like, I think I have Ebola or something. Of those 13,567, 4,951 of those have resulted in death. Back in 2012, the total number of deaths from Ebola was only 2,387, so it's more than doubled with the recent outbreak. And that was from 1976 to 2012 was that statistic. As of 2014, in October, there's been about 1,000 new cases per week reported. The areas that are most affected are Guinea, Liberia, and Sierra Leone, with unrelated incidents recently occurring in the Democratic Republic of Congo. Now to touch base here in home, that is U.S. cases. On September 30th was our first case, and that was in Texas. A man from Liberia who was helping the cause over there came over, and he started to show symptoms within 4 days. 2 healthcare workers on October 10th and also on October 15th were also reported to have Ebola, and they were quarantined. They have since recovered, one being on October 28th and the other being on October 24th. The man who, patient 0 here in the U.S., actually died on October 8th. Most recently, out of the total of 4 cases in the U.S., it's a man traveling from Guinea. He's currently quarantined in New York City, undergoing treatment. Thank you.
Okay, then we will go into the opponents. You may give your opening and your rebuttal.
Okay. So I got a question to start off with. When you get off a plane or you're sick, what's the first thing you want to do?
Get unsick.
Go home. Go to bed. Go home, go to bed.
Be unsick.
So imagine getting off a plane from somewhere and you've just helped like so many sick people or all this other stuff. And they tell you, oh, you can't go home. We're going to take you to a hospital. We're going to quarantine you for 21 days because we think you might have a disease that you might not have. So today, my group, they're going to talk about why those traveling from West Africa shouldn't be quarantined. There are many reasons why people think that they should be, but there are also many reasons why they shouldn't be. But we're going to focus on 3 main reasons, and those are the financial burden, the lack of knowledge, and freedom. I mean, if you think about it, when you get off of a plane, you want to get your bags, you want to go home, you want to sleep. You don't want to end up in like a hospital with a whole bunch of strangers you don't know. Yeah.
Okay, so Shamika touched on the financial burden, lack of knowledge, and the freedom. So the cost of quarantine is really expensive. According to Wes, there is police protection, transportation, medical facilities, training hospital staff, and patient care, and much more. Now, according to Wes, there's 150 people that arrive from West Africa daily, and that does not include the healthcare workers that are being quarantined. Even if you just travel to an area in West Africa, you are going to be quarantined. For example, there was a family of 6 that recently
Haven, Connecticut, and there has to be a police officer staffed outside their house 24 hours a day, and they have to have the health department come in a couple times a day to check on these patients. And that costs at least $1,000 a day for that one family alone. According to Ferger, the North Shore LAJ Hospital recently spent 10 to 15 million in preparation, building an isolation unit for a potential outbreak of Ebola in the U.S. They've so far had 20 cases, and all of them came back negative. Next is the lack of income. If you're being quarantined, you have to stay in your house, you cannot work, you have a mortgage, you have bills. And the government agreed that if your employer does not cover the cost of paying you for being quarantined, then the state is going to pay that. Next is the lack of knowledge. Now, it is very unlikely, according to Alzheimer, that you are going to get the disease. It's only contracted from symptomatic person's body fluids such as blood, vomit, or feces. And you are only infectious after they become symptomatic. So as soon as you're showing a sign of a fever, that's when you can give it to someone else. But as long as you're not, then you can't give it to anyone else. It is just as effective if you monitor your temperature twice a day, and that is less restrictive of people's movements than being quarantined. Next is the media propaganda. So far, the media has given a huge fear to the public that this disease is terrible, but so far, only it's done is making it worse. This has swayed doctors and nurses from going over to help the cases in West Africa, and it's only making it worse as they need critical care. And recently there was an election. So as you know, Governor Andrew Cuomo, he was for the quarantine of people, and putting people in quarantine will win him a few votes, and he did win re-election. And politicians are not scientists, and although quarantine will harm their campaign, it will harm global public health. Last is freedom. We all have a freedom to the right of movement. According to Lander, in 1984, there was an example of the AIDS epidemic that broke out, and 50% of Americans believed that those with AIDS should be quarantined. Now AIDS activists are protesting quarantines. And I'm going to end off with a quote by Casey, who is a nurse that is now suing. He said, "Such action would be illegal and unconstitutional, and we would seek to protect Casey's rights as an American citizen under the Constitution. There is no medical risk, and we have to deal with fact and not hysteria." And that was Hebe.
For daily treatment, the Ebola virus costs the hospital around $25,000 a day for treatment and doctor and nurse's aid. So, what she said about how quarantine is not spread in the hospital is wrong because a nurse contracted the virus by her neck. So, kind of against that a little bit. And in the early Ebola symptoms, nearly 5,000 died. That was during the early signs of Ebola. By that time, there was really no treatment. No one knew what Ebola was. So it was kind of hard for anyone to tell what kind of virus it was. Quarantine is not like... Quarantine really takes away constitutional rights of the people, so it's very hard for people if they have jobs, schools.
My opposition did state some good points, but let's get into this. Financial costs may be high, but think about your neighbors, your sisters, your wives, everyone you come into contact with every day of your life. Physical contact. You touch them. You sneeze on them. I mean, yes, I said that's not airborne, but sneezing, and coughing and producing particles that are bigger, like splats of like spit, that's